Hi, I'm Dr. Sudarshan Ballal, Chairman Manipal Hospitals, Manipal Health Enterprises Private Limited, Bangalore. It's been a super journey. Actually, I started off in the Manipal group as a student at the age of 16. I did my medical school at Kasturba Medical College, my MBBS and subsequently my MD, and then of course had a stint abroad in the US for my training for about 10 years. And then I moved into Bangalore when we started the healthcare division of the Manipal group. Manipal Hospital, Bangalore was our first foray into corporate healthcare, and this hospital started in 1991, and I was one of the first few doctors to come and join this place. We started off, I'm a nephrologist by profession. We started off with 2 dialysis machines and really no department to speak about. Now we have over 100 machines, thousands of patients, and one of the largest divisions of nephrology in the country and a very active training program. My growth in Manipal has been a very, very interesting and exciting growth for me. Having started as a student, then I became a consultant in nephrology, the head of nephrology, director of Institute of Nephrology and Urology, subsequently moved in as the medical director of the Manipal Group of Hospitals, and I've recently been appointed as the chairman of the board of Manipal Hospitals. So to start from being a student to become the chairman has been a very, very exciting growth for me, and I'm really very excited about this new role. And also the fact that I'm a homegrown boy, so to speak, gives me a lot of advantages. Oh, well, that's a very interesting question you ask, and this is something that I have been talking about even while I was in the US. I think many a time it's not a good idea for us to ape the West very blindly. I think the US moved into the field of specialization, and there was a specialization for each and every part of the body, and sometimes many specialists for the same part of the body. And I think unnecessarily we have aped this, causing a lot of problems. I still today believe that we need general physicians or family physicians as a primary caregiver, and they should decide whether you need to see a specialist or not. Because in general, if the patients directly go to a specialist, they are in all probability likely to get very good care as far as the organ that they've gone to see them for, but the totality of care will not be there. So in the US, things are changing. Now family physicians have come back in a big way. The British system still has a lot of general practitioners, and I think in India we should promote that, and that's been something that I've been saying for a long time. Because unless you have a family physician or a general practitioner who you can call at any time, and it's not just your doctor, but also your family friend who can guide you at the time of crisis, things will not go right. Because each specialist you see will only concentrate on the organ that he or she is familiar with. So always think of having a general practitioner or a family physician and let them direct you as to where you need to go when there is a problem. No, absolutely. I think things are changing and we have to change, otherwise we'll be left behind in the race. I think we are on a treadmill. If you slow down, you'll be thrown out of the treadmill. So I think it's very important for us to adapt technology the way it comes. For instance, when I first used my so-called portable phone in the US, it was a monstrous thing that I had in the car. And my excitement was that I could call my home in India from my car, and that was way back in the early 80s. And then, of course, when I came back to India, it was still a huge contraption. But no one now can think of a life without a cell phone. I don't have my cell phone for 5 minutes. I feel I've lost everything in life. So I think we have to adapt, and it's necessary. And that is the reason now today Manipal has tied up with IBM in the field of cognitive computing for the first time in this country, which will be a great boon not only for the oncologists or the cancer specialists, but also for the cancer patients. And we are very proud that we have gotten into this technology for the very first time in this country. Now, you have brought up a very important aspect of Indian healthcare, which is the cost for the patient. We at Manipal are very cognizant of that, and especially having worked in the US for a fairly long period of time and have been exposed to the Western system of medicine where Medicare or NHS pays for your healthcare versus in India, most of which is out-of-pocket expenses. I think we have to be very cognizant of the cost of healthcare to the common man. And whatever technology we adapt or adopt, we always make sure that costing is an important part of the decision making. For instance, today we have adopted the Watson oncology issues for our patients with the cancer. in collaboration with our cancer specialists of the Manipal group. And we have taken a conscious effort at the highest level of the organization that this would be offered to the poorest of patients in our system and also patients of the richer class. So it is affordable to even the common man, and it will be priced in such a manner where it will have very little impact on the patient's pocket. I cannot offhand discuss the prices today, but our plan is when the pricing does happen, it will not impact the poor patients in a big way at all. See, I think there are many sort of failures in the healthcare system. One is we are a very vast country with limited resources, and I think even a country like the US, which spends trillions of dollars, almost 17% of their GDP, and their healthcare spend is more than the Indian economy, is still finding it difficult to meet the healthcare needs. And I think it's very important that we have to be cost conscious. In my opinion, not enough emphasis has been given to preventive and primary healthcare in India and abroad. And I think that's a very major focus shift that we need to have, because prevention and primary healthcare can prevent many of the diseases which are very expensive to treat. Unfortunately, again, here we have gone into the field of treating illness rather than creating wellness. And treating of illness is always much more expensive than wellness creation. And I think we should have a dramatic change in the way we approach healthcare in our country. See, many of the expensive technology, whether it be proton beam therapy, whether it be robotic surgery or any of the new technologies that have been adopted for patient care, has its own advantages, but obviously the disadvantage is the cost of therapy, which ultimately the patients have to bear. So my opinion is we need to have a combination of both. I predominantly believe that the government should look at primary and preventive health care, maybe some secondary health care, and should partner with the private sector for tertiary and quaternary care. And that some form of universal insurance is needed, because it's way beyond the means of the common man to have a kidney transplant or a cancer cure, chemotherapy, brain surgery, so on and so forth, because we find that even the Western world is finding it very difficult to meet the demands of healthcare, which are ever growing each day. Certainly this question has been asked of me before, and I volunteered this information in many of my public talks earlier. If I were the health minister today, I would change the focus of the country, as I said, primarily to prevention, primary care, secondary care, and really not spend too much of resources on the tertiary care from the government sector. To give you an example, if we provide clean drinking water and sanitation, we can save millions of children each year, far more than all the hospitals in this country put together. And that will cost you probably less than 0.1% of your healthcare budget. So for the cost of a kidney transplantation or a heart surgery or a brain surgery, you can probably save thousands, maybe hundreds of thousands of children. And I think that's where the government should focus. Preventive care in the form of clean drinking water, sanitation, vaccination, and awareness of healthcare among the general public, and make sure that children, especially pregnant women, that is antenatal, neonatal care, and postnatal care, would save a lot more lives than all the money that we spend in tertiary health care in this country, not only in this country, anywhere else in the world. It is still a shame that we have such high infant mortality and maternal mortality rates, almost on par with some of the African countries, when we are very developed in some other ways.
And where do you see Manipal Hospital in the near future?
I think Manipal Hospital has a combination of outpatient care, primary care, secondary care, tertiary and quaternary care, and I think we have grown very well. The other beauty of Manipal Hospital, I think it has beautifully amalgamated medical education with healthcare. If you see, Manipal was a pioneer in the field of medical education. The first private medical college in India happened to be the Manipal group of hospitals, which happened in 1953 in a very remote village called Manipal. I grew up around Manipal, and I still remember there were tigers roaming in Manipal when the time the medical college was there, and we still have a place called Tiger Circle, which is in the middle of a dense forest. And look at Manipal today. It's probably one of the best private universities in the world. And I think Manipal has grown in leaps and bounds as far as medical education is concerned, and I'm very happy to state that we have done the same in the field of healthcare. We got into healthcare in the early 90s, in 1991 to be precise, and now we are one of the largest players in the country. And to me, being the largest is not the issue. I think being the best and having a social conscience is far more important than being the largest. You are right. I think one of the biggest problems in India is there's no standardization. Whether it's medical colleges, you may have the best of medical colleges. Of course, there are some rating systems now available to rate various medical colleges and hospitals. And we are proud that the Manipal group of institutions, whether it's the medical college or the hospital, have always been ranked very high in the rankings of various organizations. So I think what is important for us at Manipal, and I have seen various medical colleges both within and outside of the country, is that they provide standard education and they are above board, very ethical in their practice and very transparent. And probably Manipal group of medical colleges are one of the very few where the fees is open and everything is transparent. There is nothing like buying your seat or selling a seat. It is all transparent based on a ranking system in the exams that you take. Well, I think one is I would like to be major changes in the medical education. It is unfair to me that about 100,000 or 200,000 students apply to get a medical seat and less than 1,000 or 5,000 get into the medical college. And once you've passed your MBBS, there's a huge bottleneck. There are 1/3 the number of postgraduate seats as compared to undergraduate seats, whereas it's the opposite in the US. So a lot of these MBBS doctors are jobless. They pass their exams, MBBS, they don't know what to do, and the rest of their lives they spend appearing for entrance exams, and it's so very difficult, and also it's very, very expensive to get into private medical colleges. So obviously there's a lot of roadblocks in having enough doctors in this country, and a lot of times I go on these camps where we try to encourage youngsters to become doctors, and they ask me this question: how can I afford to be a doctor in the system that we have? So I think we need to open more medical colleges which are regulated, not unregulated. We need to equalize the undergraduate and the postgraduate seats. And also I feel there's a huge number of corporate hospitals with excellent facilities which should be opened up for postgraduate training. Right now, postgraduate training other than DNB is limited to the medical colleges alone, whereas there are a huge number of private hospitals which have very good doctors, very good infrastructure, very good teachers, which should be utilized to educate young doctors. For instance, now we have 70% of the healthcare, at least in the tertiary care, run by the private sector in our country. So I think these should be used to train our young doctors. I think we need a combination of both. As I see it, India needs a large number of MBBS doctors. We need a large number of specialists, and they then need not be super specialists. For instance, in the modern day, no delivery will be conducted by an MBBS doctor. You have to have an obstetrician who needs to have a DG or an MD. And of course, in the modern day, no MBBS doctor would be capable or would be advised to give anesthesia. So you need the MBBS doctor to be a GP or a family physician, but you also need an equal number of specialists. The specialists are needed for people who have illnesses that need to be taken care of by a specialist. But my firm belief is that all of us should have a family physician who should be our mentor and guide, not only for illnesses, for many other things, and they should be the one who guide us as to where to go in case there's a more complex illness.
Thank you.
Thank you.